1. What is the primary role of toxicology in public health? A. Monitoring environmental pollutants. B. Assessing the impact of toxic substances on human health. C. Developing new pharmaceutical drugs. D. Managing healthcare finances. 2. Which of the following is a key principle of toxicology? A. Toxicity varies based on dosage. B. All chemicals are equally harmful. C. Only synthetic substances are toxic. D. Toxicity is independent of exposure duration. 3. In the context of toxicology, what does the term LD50 represent? A. The lethal dose for 50% of a population. B. The limit of toxicity for 50% of chemicals. C. The lowest dose that causes a response. The dose that shows no effect in 50% of individuals. 4. Which agency is primarily responsible for regulating toxic substances in the United States? A. Food and Drug Administration, FDA. B. Centers for Disease Control and Prevention, CDC. C. Environmental Protection Agency, EPA. D. National Institute for Occupational Safety and Health, NIOSH. 5. What is the primary function of the blood-brain barrier? A. To filter harmful toxins from the bloodstream. B. To prevent substances from entering the brain. C. To aid in the absorption of essential nutrients. D. To regulate body temperature. 6. What is the most common method for assessing the toxicity of a substance? A. Animal testing. B. Human clinical trials. C. Environmental sampling. D. Epidemiological studies. 7. Which of the following is an example of a chronic toxic effect? A. Acute poisoning from ingesting a toxic substance. B. Lung cancer caused by long-term exposure to asbestos. C. Skin irritation from a chemical burn. D. Headache from a short-term exposure to fumes. 8. What does the term bioaccumulation refer to? A. The increase in the concentration of a substance in the environment. B. The process by which organisms accumulate pollutants from food chains. C. The breakdown of toxins in the liver. D. The expulsion of toxic substances through excretion. 9. Which of the following is a key component of a toxicological risk assessment? A. Estimating the exposure levels of individuals or populations. B. Predicting the economic impact of environmental policies. C. Determining the ethical implications of research findings. D. Monitoring the temperature and humidity in a laboratory setting. 10. Which toxicological factor is most important when assessing risk from a chemical exposure? A. The cost of the chemical. E. The duration and level of exposure. C. The color of the chemical. The time of day the exposure occurred. 11. What type of chemical reaction is most responsible for acute toxicity? A. Oxidation. B. Hydrolysis. C. Reduction. D. Enzyme inhibition. 12. Which of the following is true regarding the toxicological study of pesticides? A. All pesticides are banned in the United States. B. Only agricultural workers are at risk of pesticide exposure. C. Pesticide studies are primarily focused on the safety of consumers and the environment. D. Pesticides are always effective without side effects. 13. How do toxicologists evaluate the potential for a substance to cause cancer? A. By conducting animal studies focused on genotoxicity. Through human clinical trials for cancer treatment. C. By analyzing the economic costs of cancer treatment. D. By measuring the amount of the substance in water supplies. 14. What is the term used to describe the study of the effects of chemicals on the development of organisms? A. Developmental toxicology. B. Molecular toxicology. C. Neurotoxicology. D. Environmental toxicology. 15. Which of the following best describes the principle of toxicokinetics? A. The study of how toxins accumulate in tissues over time. B. The study of how the body absorbs, distributes, metabolizes, and excretes chemicals. C. The measurement of harmful chemicals in the atmosphere. D. The prevention of toxic exposure in high-risk populations. 16. Which of the following is a common method of chemical detoxification in the liver? A. Methylation. B. Conjugation with glucuronic acid. C. Hydrolysis of fat-soluble compounds. D. Breakdown by microbiota in the colon. 17. What is the role of toxicology in occupational health? A. Preventing workplace injuries caused by machinery. B. Assessing and controlling the risks associated with hazardous chemicals in the workplace. C. Managing employees' health insurance plans. D. Setting regulations for employee work hours. 18. What is the significance of the threshold limit value, TLV, in toxicology? A. It is the maximum dose of a chemical that can cause irreversible damage. B. It is the highest concentration of a substance to which workers can be exposed over a set period without adverse health effects. C. It is the lowest dose that causes a toxic response in humans. D. It is the legal limit for environmental pollutants in public spaces. 19. Which of the following best describes a mutagenic effect? A. A change in DNA that causes cancer. B. A chemical that causes birth defects. C. A chemical that alters genetic material in a way that can be passed to offspring. D. A reaction that disrupts normal cellular metabolism. 20. What does the term toxicodynamics refer to? A. The study of how the body handles and processes toxins. B. The measurement of the concentration of toxins in tissues. C. The study of how toxins interact with biological systems and produce effects. D. The process of detoxifying harmful substances from the body. 21. Which type of chemical exposure is most likely to cause neurological damage? A. Long-term exposure to heavy metals. B. Short-term exposure to cleaning products. C. Occasional exposure to pesticides. D. Exposure to cosmetic chemicals. 22. Which of the following regulatory agencies sets guidelines for exposure to chemicals in the workplace? A. Food and Drug Administration, FDA. B. Occupational Safety and Health Administration, OSHA. C. National Institutes of Health, NIH. D. Environmental Protection Agency, EPA. 23. Which of the following substances is commonly associated with developmental toxicity? A. Lead. B. Oxygen. C. Water. D. Glucose. 24. What is a potential effect of long-term exposure to endocrine-disrupting chemicals, EDCs? A. Reduced fertility. B. Rapid healing of wounds. C. Enhanced physical strength. D. Improved immune function. 25. In the context of toxicology, what does hazard identification involve? A. Estimating the financial costs of exposure. B. Analyzing the chemical structure of a substance. C. Identifying potential harmful effects of a substance based on exposure scenarios. D. Implementing interventions to reduce toxicity. 26. What is the focus of forensic toxicology? A. Studying the impact of toxins on wildlife populations. E. Analyzing chemical exposure in criminal investigations. C. Developing new pharmaceutical drugs. D. Assessing the effectiveness of detox diets. 27. What is the first step in evaluating the toxicity of a chemical? A. Determining its lethal dose. B. Performing animal testing to observe effects. C. Analyzing its chemical structure. D. Identifying the potential routes of exposure. 28. Which of the following describes an acute toxicity study? A. A study that examines long-term health effects of a chemical. B. A study that assesses the effects of a single dose of a substance. C. A study that tests the interaction between two or more substances. D. A study focusing on the impact of a substance on the environment. 29. Which factor most influences the toxicological impact of an environmental pollutant? A. The color of the substance. B. The geographical location of exposure. C. The dose and duration of exposure. D. The time of year the exposure occurs. 30. What type of testing is commonly used to evaluate the mutagenicity of a substance? A. Ames test. B. Skin irritation test. C. Long-term animal study. D. Human clinical trials. 31. Which is the primary function of toxicological risk assessment? A. To determine the economic value of chemical products. To identify chemicals that are hazardous to human health and the environment. C. To evaluate the efficacy of chemical treatments. D. To assess the environmental impact of manufacturing processes. 32. Which of the following is an example of a common neurotoxic substance? A. Arsenic. B. Asbestos. C. Mercury. D. Acetone.